Hello, and thank you all for being here today. Today I'd like to talk to you about an infection known as an MRSA. What that is, its actual name is methicillin-resistant Staphylococcus aureus. Now, if you've ever had a sore just appear on you that you thought was a spider bite or kind of looked like a spider bite, but you've actually never seen the spider before, then it probably is not a spider, it probably is MRSA. Now, on the CDC.gov website, they say early recognition and treatment for this infection will help you to reduce any kind of ill effects that come from it. Now, I've worked in the medical field for a while. I've worked in surgery and I've worked also on the floor, and I've seen firsthand how this infection can get very severe. One of the things I'd like to tell you about today is the cause of this MRSA infection, the signs of it, how to treat it, and a little bit of facts and myths that go along with this. Now, on CNN.com, they, along with the Mayo Clinic, have an article out that states the type of, the cause of this infection. Now, what it is we are all colonized with a bacteria known as staph. Now, this type of staph, it has come about being resistant because of decades of misuse of antibiotics. Now, here is a picture of an electron micrograph of this. It's colored. This is the actual bacteria here, and it's zoomed in 20,000 times so that you can see it. As you can see here, it looks like it has a really thick wall, and so it makes it harder or more resistant to antibiotics. Now, Vanja Duke wrote an article called Epidemics of Community-Associated MRSA in the United States. Now, he listed some risk factors. One of the things is, big risk, it used to be if you were a hospitalized patient, you would come up with this just in the hospital. But more frequently, causes are just now it's in the community. And even in healthy people you see this, not just people who are in the hospital. People who are at risk, if you have anybody in your household who is infected with this, you can get it from just skin-to-skin contact with them. People who are in sports, nursing homes, schools have it prevalent in there, and then also in jails. Now, here's a picture of someone who is an inmate in a prison, and this is what it looks like. It starts as a little sore, and then it starts to weep just a little bit. Some of the signs that you think, like I said, you think it's a spider bite, but the difference between that is it starts to get worse rapidly. It'll start to drain, as you saw in the picture, and then a lot of times it'll start from a cut or abrasion on your skin. Now, when you go to the doctor, he does diagnose this, and how he does it, if you come in and you say, man, I think a spider just bit me or something, but you didn't see one. Well, that's a kind of a red flag for him, and then he will, it's kind of raises suspicion, especially if there's a lot of draining and pus from it. So what the doctor will do, he will take some cultures of this to determine exactly if it is a spider or if it is an infection with the MRSA. Now, Maureen Farquhar wrote an article called Increasing Resistance to Vancomycin, a Myth or a Reality. One of the medicines that doctors generally use is called vancomycin. It's an antibiotic. Well, unfortunately, we're starting to gain a resistance to this antibiotic, vancomycin, and not just that, but all kinds of antibiotics. So sometimes the choice that we use for the vancomycin is not working. Now, with any illness, knowing that you have a painful sore and having to go to the doctor for treatment can be kind of scary. So I'd like to ease some of your concerns and tell you about some common misconceptions and truth about this. First off, Michelle Moore wrote an article titled 7 MRSA Myths. and so that it can, because some of these facts and myths do create some confusion. The first myth is that antibiotics will stop your infection. Not necessarily. Now, like I said earlier, antibiotics are becoming a little bit more resistant. That there has to be a cure. No, even with antibiotics, after treatment, you can get it back. MRSA is only in hospitals. Like I said, it used to be, but now it's becoming prevalent even more in the community. Your doctor knows best. Usually he does, but you have to be an advocate for yourself, and you have to also think about, you know, are there some other treatments just besides antibiotics? MRSA is not a big deal. It can be a big deal. It can become life-threatening. And the testing is unnecessary. Testing is actually very necessary so that you know which antibiotic and which treatment works best for this type of illness. And also it depends on the person who is sick with this. If you get MRSA, you'll always have it. That's not true. With good treatment, multifocal treatment, you can decolonize yourself. Now, some facts is that it's not just the use of antibiotics, it's also the use of not taking all the antibiotics that are prescribed to you. Antibiotics end up in your water supply, so it makes some of the bacteria become resistant. And now there's an increase in the superbug for C. diff and A. baumannii that is becoming more prevalent than MRSA. Now, I've told you about a little bit of causes, symptoms, and treatments, myths and facts. It's important to remember that even though hospital MRSA infections are on a decrease, community is on an increase, and no one is immune. No one in the world. Thank you.
Nice.
That was good. Get to read a little fast for him. I know, I was starting to get anxious. I know, 'cause you're getting down. But you can't go over.